Hello everyone. Today I shall discuss the role of a metabolic substance, amino acid, and its derivative S-adenosyl-methionine or SAM in the treatment of osteoarthritis. As we all know, osteoarthritis is a degenerative joint disease affecting aged population, more in females as they age. Few treatment options available for the cure of the disease. The major focus of the treatment is on the pain relief, reducing inflammation, and preventing joint cartilage destruction. And many agents have been tried for this purpose, including pain relievers, disease modifying drugs, hyaluronidase, chondroitin sulfate, but the evidence of their efficacy remains to be known still. SAMA is a intermediate found in every cell. It acts as a methyl donor in several biological reactions such as methylation, synthesis of neurotransmitters, serotonin, dopamine, glutathione synthesis in liver, which is hepatoprotective, and formation of nucleosides which are needed for DNA synthesis. The transferase enzymes such as called orthomethyl transferase, the methyl transferase, phenolic methyl transferase, thiopurine methyl transferase, and thiol methyl transferase. They are all involved in such reactions of methylation, and they all require SAMe as methyl donor. Nicotinamide and methyl transferase methylates serotonin and tryptophan, so they play a role in neurotransmission in brain. PNMT methylates noradrenaline to make adrenaline, and COMT methylates monoamines for their inactivation, including some drugs such as alpha-methyl dopa. TMT catalyzes methylation of many drugs actually. Most of them are immunosuppressive and anti-cancer drugs. It is also involved in arsenic metabolism in body and chronic toxicity. Deficiency of vitamin B12 and folic acid reduces formation of methionine, and therefore it reduces brain concentration of SAMe. It helps in the formation of proteoglycans in the cartilage, and hence it has been tried. In fact, looking to this physiological role, we can say it has pleiotropic, many-faceted effects, but the key effect is conversion of the key effect is methyl donation, and since S-adenosyl-methionine is not not found in the food, whereas its precursor methionine is found, that is converted into S-adenosyl-methionine in body. The key reactions can be summarized as one of the important reactions is methylation for neurotransmission and DNA synthesis, transsulfuration for liver function and prevention of liver injury, and aminopropylation for the formation of polyamines, with some of them control cell growth and have anti-inflammatory activity. These things are interrelated actually. Now, pathological role of SAMe is also being found. Low concentration of serotonin and its metabolites and SAMe are found in CSF of patients with depression. Reduced brain concentration of SAMe is reported in several brain regions of the patients with Alzheimer's disease. Reduced same concentration in CSF is also reported in patients with subacute combined degeneration of the spinal cord that may result from vitamin B12 or folic acid deficiency. Reduced CSF concentration of same is also found in children in born error of methyl transfer pathways. Reduced CSF concentration of same is reported in HIV infected children and adults. In liver disease, methionine is not adequately converted into SAM, so there is reduced glutathione formation as a result of poor methyl transferase reaction. An interesting drug is tabemetostat, which is an oral drug which is like S-adenosyl-methionine, so it is a competitive inhibitor of the methyl transferase, specifically histone methyl transferase, and it has been tried in metastatic epithelioid sarcoma in human beings. Dietary sources of methionine. As told you earlier, SAM is not found in diet, whereas its precursor methionine is found. And methionine-rich foods are non-vegetarian sources: meat, fish, eggs, dairy products, nuts and seeds, Brazil nuts, sesame seeds, and sunflower seeds, grains, oats, and quinoa. Soya-based foods are also rich in methionine. Now, beneficial effects of the same, that is S-adenosyl-L-methionine, in the treatment of osteoarthritis is the focus of discussion, and it has been recently reviewed by Bottiglieri. The reference is cited in the last. Now, there is experimental studies show that SAM increases chondrocyte proteoglycan synthesis and also increases proliferation, so preserves cartilage. It prevents proteolytic destruction of the cartilage, so prevent destruction of the cartilage. So it makes more cartilage and reduces destruction of cartilage. By these two mechanisms, it can prevent degeneration of the joint, and clinical improvement is there in the form of pain relief and anti-inflammatory activity. Some anti-platelet activity has been shown. Its clinical relevance could be only as regards drug. Orally, if it is given, but the absorption is incomplete, but bioavailability can be increased when taken with food, but it can be taken without food also. It is widely distributed after absorption, and almost every cell would have, so that it is converted into SAMe, including CSF. It is taken up by hepatocytes and found in mitochondria. It is usually given as an SAMe is usually given as extended release formulation to obtain sustained stay in body. Oral administration of SAM in a dose of 400 mg for 7 days to 4 subjects significantly increased SAM concentration in the synovial joint fluid, and that itself shows that it is involved in cartilage synthesis and prevention. Potential uses are many, but the three are important. One of them is prevention of alcoholic liver disease and cholestasis. Second is endogenous depression and Alzheimer's disease, and the third is osteoarthritis. I will talk of osteoarthritis in this. It was a serendipitous observation that patients of depression receiving SAMe found improvement in joint pains in 1976. Thereafter, large number of studies have been done, and meta-analysis of these studies, particularly from Europe, including 22,000 participants, showed that there was some effect of SAMe in osteoarthritis in the form of clinical improvement, pain reduction, reduction in the stiffness. Another study of randomized placebo-controlled trial used SAM initially IV and then orally, and they found it to be effective. The study was from USA. Gayatri in India conducted comparative trial between diacerin, another agent used in osteoarthritis, and SAMe, and they found that there was a reduction in the pain, profound reduction in pain starting from 4th to 12th week of the therapy, and overall adverse effects were more in diacerin group than in the SAM group. The SAM was better tolerated, although GIT adverse effects were known to occur with diacerin as well as to some extent with the SAMe group. This is a recent study that shows it is a double-blind, placebo-controlled, short-term trial. Combination of glucosamine sulfate, chondroitin sulfate, and S-adenosyl-methionine. And it was extensively studied to find the impact on the inflammatory markers as well. It was found that there was 13% reduction in the synovial thickness in the group receiving this drug, and 90% of the both groups showed synovial fluid reduction after 6 months of treatment. Modest increase in the articular cartilage thickness in both groups was seen, and there was reduction in the inflammatory markers. Therefore, it can be said that many of the agents such as glucosamine, chondroitin along with S-adenosyl would produce a better effect in different. Another is two studies compared use of celecoxib, etoricoxib as against the SAMe, and both the groups found that SAMe had either equal or more clinical improvement as compared to COX-2 inhibition. Adverse effects and tolerability of SAMe is well known. Mild GI adverse effects are known to occur. Occasionally there is headache and dizziness. It should be avoided in pregnancy and if patient is allergic to it. Concurrent use of alcohol should be avoided because hepatoproductivity will be lost. It is not indicated in bipolar disorder, only in endogenous depression. Fukimoto recently studied and found that it should not be given in excess, because excess may itself inhibit the methylation reaction, may alter human behavior. That is important. Drug-drug interactions are known to occur, and many drugs, particularly low dopamine metabolism, is affected. Antidepressant, antipsychotics, anti-migraine drugs, all may have adverse interaction. Therefore, close monitoring is required. Currently, formulation available are single ingredient 400 mg tablet, modified long-acting in different names, and combinations is also available along with folic acid, vitamin B12. Usual dose is low dose maintenance 400 mg once or twice daily, but the dose range studied so far is 200 mg to 1200 mg. So in summary, we can say that it is a cofactor methyl donor for key biochemical reactions needed in body. Its precursor is L-methionine, found in many food sources. It has shown hepatoprotective, chondroprotective and anti-inflammatory activity. It facilitates neuronal function. It is found to be effective in endogenous depression, alcoholic liver disease and osteoarthritis. Trials so far conducted are small scale, less robust, and there are quality issues in them. The overall clinical benefits are modest, suggesting its use as an add-on supplement, not the main drug. It is well tolerated in therapeutic doses, but potential for adverse interactions require precautions to be observed. We need to know more about how SAMe compares with physiotherapy in carefully controlled trials. At present, it is costly. If a dose of 400 or 800 mg is taken, it will be between rupees 50 to 200 rupees per day. And since it has to be taken for at least 3 to 6 months, this cost should be considered. Therefore, well-informed patients about its cost effectiveness may opt to use it as an add-on therapy against standard of care. Thank you very much. I have cited several references for in-depth study if somebody is interested more about it. And to learn more about the drugs, one may visit my YouTube channel noted here. Thank you.